Welcome, everyone. We'll get started in a few minutes. Welcome and good afternoon, everyone. Thank you so much for taking the time to join our webinar today on what matters most to home and community-based services beneficiaries of color. My name is Lena Sharma. I'm the director at the Center for Community Engagement and Health Innovation at Community Catalyst, and I will be your facilitator today. Next slide, please. Community Catalyst, we're a national organization dedicated to building the power of people to create a health system rooted in race equity and health justice, and a society where health is a right for all. We believe that together with our partners, we're building a powerful, united movement with a shared vision of and a strategy for a health system accountable to all people. We've partnered really closely with the Leading Age LTSS Center at UMass Boston for this project. The Leading Age LTSS Center conducts research designed to help the nation address challenges and seize opportunities associated with a growing older population. Their primary goal is to translate research into policy and practice, so its work can serve as a foundation for government policies and provider actions to improve quality of care and quality of life for vulnerable older adults. Next slide, please. Just a few housekeeping details before we get into the agenda. We are recording the webinar and slides will be shared afterwards. If you have any questions during the course of this webinar, please use the Q&A feature on the bottom panel of your screen, and there will be time for questions at the end. If during the webinar you have any technical issues and you need some support, please contact my colleague, Mike Brand, in the chat. His email address is right here on the screen, mbrand@communitycatalyst.org. Next slide, please. So our agenda today, we have a very exciting agenda lined up for you. We will first hear from our funders, the SCAN Foundation and the California Healthcare Foundation. We will talk a little bit about the goals and the objective of this project. And then we'll spend some time on what we did for the co-creation process, hear about some lessons learned, and then have a discussion with our community partners. And again, we'll have time for discussion and questions at the end. Next slide, please. So I want to first turn it over to our partners at the California Healthcare Foundation and then the SCAN Foundation. Kate Myers is a senior program officer at the California Healthcare Foundation, and Callie Peterson is a program officer at the SCAN Foundation. And before I do turn it over to them, a really special thank you to both of them. They have been incredible thought partners in this work and have been incredibly patient and committed to this area of work. And so we are very, very grateful that they're here today to say a few words, and then throughout the course of this project, their partnership and expertise. So I will turn it over to you, Kate.
Oh, thanks so much, Lena, and thank you for those kind words. Right back at you, to you and your team. This has been a highly collaborative effort, so thank you to you and your team as well. So hello, everyone. Good afternoon. Really happy to be here. My name is Kate Myers, and I'm a senior program officer at the California Healthcare Foundation. We are a healthcare philanthropy based in Oakland, California. And my work at CHCF focuses on older adults with complex needs, supporting partners and strategies aimed at ensuring that older people with low incomes in California get the support they need to live well at home and in their communities. And I just wanted to talk a little bit about our motivation for this specific project. Generally speaking, this was kind of born out of a desire for more and better information about access to and quality of home and community-based services in California, and specifically about access to and quality of HCBS for people of color who are dually eligible for Medicare and Medi-Cal. California's Medicaid program. We know those groups experience more chronic disease and greater complexity. So, at the core, we really wanted to know more about how California can examine quality of care, quality of home and community-based services, or HCBS, for this group of people. And as we thought about what HCBS quality is, we knew there are a lot of measures out there, but we wanted to know more about what quality really means to the people receiving care, and specifically in this case, to people of color who are dually eligible and who are receiving HCBS. We wanted to know really what matters to them. And as we as a state are assessing quality and patient experience in some ways in home and community-based services, and as the state plans out other ways to monitor quality in home and community-based services and LTSS in future years, we wanted to know more about how will we know if we're measuring what people receiving services actually care about. So we set out to try a process of looking at these kinds of questions about quality with people with lived experience of these services themselves, in collaboration and close collaboration with community partners, with a model that our grantees at Community Catalyst and the Leading Age LTSS Center at UMass Boston have termed co-creation. And they'll talk much more about what that is in just a minute and how that worked in this project. With that, again, I want to thank all the participants in this project and thank all of you for being here today, and then turn it over to my funding partner at the SCAN Foundation, Callie Peterson.
Thank you so much, Kate. And thank you again to Community Catalyst for hosting today's important discussion, as well as to my partner here, Kate, at the California Healthcare Foundation for supporting this work. And thank you to all of you for taking time out of your busy schedule to join today's discussion. My name is Callie Peterson. I'm a program officer with the SCAN Foundation. We're based in Long Beach, California, and we're really dedicated to ensuring that all older adults can age well in community with purpose. And a cornerstone of that is really hearing from older adults themselves, individuals with lived experience, expertise, that can elevate and articulate what matters to them, what's meaningful to them, so that programs and policies can meet their needs. We were especially intrigued by this project because it's not just about asking people what matters to them, it's ensuring that they're at the table to then develop solutions that meet those needs, wants, and preferences. So this concept of co-creating, bringing older adults with lived experience together with those that can support them in navigating a process to think about quality, think about home and community-based services through a quality lens, we felt was a really important process to experience and to learn from. And this is a project in which there are many lessons learned that we do hope those in the field, whether you're an academic and you're studying these topics, whether you're a provider working in community, or you're another philanthropic organization, that you can think about how to partner in community with older adults with lived experience to understand what's meaningful to them and create solutions. I hope you learned something today. I hope it's uplifting. I hope that it's challenging. Some things were not easy as part of this process, as has already been indicated. And therein lies an opportunity. And so we hope you'll lean in to this work with all of those that are speaking today, and help us continue to ignite bold and equitable changes within our systems of care for all older adults. And with that, Lena, I will pass it back to you.
Thank you, Callie, and thank you, Kate. So great to have you on the webinar. And again, just being thought partners in this project. Let's go to the next slide. So just briefly, today's presenters, we have an excellent lineup of folks who will be sharing more about the project with you. Eileen Tell, she is at the Leading Age LTSS Center. Cece Tunes from Community Catalyst. And then our wonderful community partners, we have Amina Sen Matthews from the Cambodian family, Terry Lee from the Curry Senior Center, and Lydia Misadelis, Alliance for Leadership and Education. I hope I pronounced your names correctly. And thank you so much for being here today. Our next slide, please. And And one more slide, share a little bit about this, just an overview of the project. And Kate and Callie touched a little bit on, why we embarked on this project. We know that when it comes to health and social care quality measures, the current system and the current design of it does not really take the perspectives of people with lived experience into mind. And so we wanted to better understand how the questions that are being asked and the measures, how is it being experienced by people with lived experience? And this is particularly important for older adults who are enrolled in both Medicaid and Medicare, whose complex health and social needs are greater and have a greater need for home and community-based services. And so we were wanting to understand what matters most to those who are using these services, and defining quality care as an important component in creating meaningful measurements to guide service improvement and systems change by reflecting people's lived experience and values. And so next slide, please. Our ultimate project objective was to engage duly eligible people of color in this pilot process of co-creating a set of home and community-based service quality measures focused on accessing to quality of and experiences with Medi-Cal home and community-based services, and prioritizing what aspects of HCBS quality is most important to them and what survey questions can really capture those aspects best. And so I'm going to turn it first over to Eileen, who is going to walk through our methodology and the co-creation process. So Eileen, over to you.
Thank you very much, Lena. And you go to the next slide, please, and the one after that. This was a really exciting and unusual experience for me because I have done a lot of quantitative and qualitative work. This project combined both, and people who have worked with me and know me, co-creation is not something that I've done a lot of, whoever it's with. And certainly working with community members is new to me. So I lean heavily on the expertise of our community members and our community catalyst and leading age team to accomplish that. So this is really a very high level overview of the process. And then with the progressive slides, I will dig deeper into each of these components. But obviously the community advisory committee that we established was an important grounding place for the co-creation process and the interactions to happen. The majority of the council was community groups and duly eligible adults of color. And we engaged them, to assist us in prioritizing the dimensions of quality that were important to them, help us evaluate those, and to help co-create survey questions that best measured what matters most to them. Excuse me. The working material that we used as a starting point for the survey questionnaire development was the creation of a question set inventory based on quality of care measures, questions from a variety of national and state survey instruments. And then we used both the advisory committee and direct engagement with consumers to explore what they consider of highest priority when it comes to quality care for HCBS. And we use those reflections to refine the survey questions that would best reflect how they would measure this. And in terms of engaging directly with consumers, we used focus groups and interviews. So that's the 1,000-foot level. Next slide, please. So as you see from this diagram, it clearly was not a linear process. The overarching resource, if you will, was the inventory of quality-related survey questions that we pulled from those national and state surveys. This provided the framework for the multi-directional conversations that we had about the broader aspects of what matters most. We said this a lot, we'll probably say it a lot today, when considering the quality of care in HCBS for duly eligible older adults of color. These issues and the specific domains and survey questions were explored with the advisory committee and in those direct-to-consumer conversations. And the advisory committee helped us to frame the discussion guides that we would use with the focus groups and the consumer interviews. And then the findings of those were fed back to the advisory committee as they considered in their deliberations the development of survey question sets that would best measure and reflect what we heard from the consumers. So next slide, please. The community advice, I don't know why I'm having trouble talking today, sorry. The Community Advisory Committee included both policy and research organizations, community-based provider groups serving dual eligibles of color, and consumers of HCBS from those provider organizations. The full community group, and you see those names listed here, and we'll hear from them. There's a really fascinating dialogue and conversation portion coming up. The full committee met 5 times. In addition to that, the project staff met individually with the community organizations and the individual participants in between those bi-monthly meetings. And this was really important in order to provide any additional needed information and support they might want. We did this to facilitate their fullest participation in the group meetings. In other words, we wanted to make sure that they were on an equal footing with the policy experts, because we wanted them to have equal voice when we had the full meetings. And then after each meeting, we had an really brief evaluation form, anonymous, just to make sure that we were handling the meetings and the frequency of the meetings and what we were covering, that our methodology was working for everybody. And if not, we changed things up. So the next slide, please. How did we develop the question set inventory? We identified a number of existing in-use and validated survey instruments that included questions regarding quality of care. And we leaned heavily on those that were California-based, and that were home and community-based and personal care service-based. I'm not going to read these out because I only have 10 minutes to talk, but you can see what they are here. We selected the questions, again, most relevant to, or that could be adapted most easily to reflect personal care HCBS. And we organized those questions into a set of 128 questions following the Donabedian evaluation framework for quality care domains. And as I'm sure many of you know, these are structure and access, process, and then outcomes. There were some places where we had to modify the wording to be specific to HCBS personal care. The inventory doesn't necessarily include only one question within each domain or category. If there were different ways of asking the question from these different instruments, we included them all because we wanted to test out whether one resounded more favorably than another, or how different wording might be responded to. Okay, let's go to the next slide if we may. So this quickly just shows in a more linear fashion the co-creation process. Is that where we are? Yes. So, so here are the steps. We worked again interactively with the Community Advisory Council and directly with consumers to facilitate discussions of what does quality care mean in this context? How should we ask this of dual eligibles of color to best reflect their priorities? And we continued by linking the priority areas of concern to the specific sets of questions from the inventory bank. And then we would get feedback on the question wording and structure, and then ask what might be missing, and continue on and repeat the process. So let me focus in. I think this will be of most interest to folks on the call, showing you how what the domains and specific matters of interest are that were organized And when you get the issue brief after this call, you'll see the questions that pertain to these items. So here we see the structure and access. In the first column, you have the quality dimensions, structure, access, process, and outcomes. And then you have the specific matters of concern, we're calling them, that fit within each of those: finding care, transportation, within structured access, within process, it's staff consistency, service plan development, within outcomes, just to give an example, problems with care, discrimination, post-acute care. So these were the kind of issues that we explored. So let me just, on the next slide, if you would, give you an example of how we would work with both the Community Advisory Council and also the focus groups when we were exploring and trying to unearth priorities. When we were looking to understand what's most important within a domain, for example, within structure and access, specifically about finding care, we wanted to understand how individuals preferred the question to be asked, or what aspect of finding care was most important, which is what this question really asked about. We said, which question best described what's important to you when you think about finding care? And so you see and these all came from the surveys that we looked at with regard to this domain. And the last one, question 5, was something that was volunteered by the group. So we did allow anything else or what's missing or other, please fill in the blank. So we did get some voluntary responses from the co-creators that we were working with to see if there was something that was missing, or a topic that was missing that we didn't address. On the next slide, you can see an example of an exercise we did intended to understand how we might prioritize aspects of quality of care that cut across domains. This was a ranking exercise where we asked folks to tell us how they would rank these issues. So we said, here are some things people told us they care about when receiving home and community-based care. Please rank these in the order of importance to you. Ability to get personal care, receive information in the language you prefer, providers work collaboratively, do they understand what's important to you? Do you know what to do if you have a complaint? So these cut across those different domains, and in some cases, matters of concern within those domains. And I'll talk about the results of this ranking exercise shortly. Okay, the next slide, please. Am I going too quickly or just quickly enough? I will let somebody let me know. So we did a series of focus groups and interviews designed in collaboration with the Community Advisory Council, with consumers, people of color, and actual consumers of home and community-based services. And for the most part, they were broadly exploratory. We were asking mostly what matters most to you when you think about quality of care, the personal care you've received. Describe what makes the care visit good. Have you had a bad experience? What made that so? And in talking through all this, we probed and looked for all the dimensions and domains that were covered. So if somebody didn't mention comfort in terms of discrimination or cultural respect, consistency of staff, being taken seriously, we probed for all of those issues. Next slide, please. In the Spanish-speaking group, we did something a little bit different. We actually, this was the last one we did, and we actually had gotten down to a point where we had some language and some questions that we thought represented some pretty good examples of priority areas and ways to ask questions. And we wanted to test that. We presented a 20-item test survey, but we did it incrementally, meaning one set at a time. So we tested alternative question sets, kind of 2 questions at a time that measured the same thing. So 2 different ways of asking about finding care, 2 different ways about asking about post-hospital discharge support at home. And then ask them, and sometimes there were more than 2, I think, and asked people to circle what they preferred and then talk about why that was their preference. We also explored preference for different answer categories. How strongly they felt, like a Likert scale or a yes/no answer. And then again, explored preferences in that regard. And respondents obviously commented on the clarity of the questions, their comfort level, the relevance of the questions, was anything missing? And in fact, it was raised both in this group and in earlier groups that there were issues of concern that were missing. Okay, last slide, I believe. So this slide shows the relative importance to the consumers. And it's important to mention the consumers, beneficiaries, unique to this study. This was a small number of people. It's not representative, as any qualitative research would not be, but it's especially not representative because it's just the people that we talk to, and other groups would have, other individuals may have different experiences, and I'll explain that in a minute. But what we found here, and we've organized it the same way you saw before, we've highlighted in the dark green, they're all green or gray, some are gray. In the dark green, those emerged as the highest priority when we asked people to rank. Consistently, these came out as more important than other domains. So finding care, having care provided in a language and with cultural respect, in a way people could understand it. Knowing how to handle problems, or and having problems with care addressed. Post-acute care, this surprised us. We would not have expected that being able to get the care and support you need post-discharge to be able to sustain care at home. Makes sense now, but we just didn't see it as rising to the top above all others. For example, I would have thought staff consistency, being able to get the same staff people or know reliably who's going to be coming into your home, things like that, and problems with discrimination. So those were the highest order of concern. To a lesser extent, care management coordination, knowing that your providers of care are coordinating and in sync with each other. And then the other ones were didn't rise to the top, as we said, but something that came out as missing that folks wanted to see included was empathy. Did they feel that the providers of care cared about their well-being? That was something that they wanted to see included that hadn't emerged from any of the question sets that we had. And the reason I say it's relative to this group is because these may be folks that are living in an area where it's harder to find care. So if you can't find care, and if that's your biggest challenge, you're going to be less concerned with who shows up because you care that somebody shows up. And so once the logistics of having reliable care available to you is solved, then something else is going to rise to the top for you. And so I think what's important is always going to be relative to the care situation, the provider situation, the geography, the family circumstances. It's always going to be relative to the situation the individual's in. And that sounds incredibly intuitive, but I think that helps to explain these priorities and the fact that the priorities are always going to be unique and shifting for different populations. So that, I believe, concludes my remarks, and I'm handing it off to Cece, I believe. Was I timely?
Thank you, Eileen. Appreciate you passing that off to me. Hello, everyone. My name is Cece Tunis. I use she, her pronouns. I am a senior state advocacy manager with Community Catalyst. I've been working really closely with our partners in California on this project. And I'm very pleased to report some of the key lessons learned that we were able to glean through community engagement on this project. Next slide, please. So you're going to see here on this slide some of the basic things that that we were able to identify as key lessons learned, but I want to kind of expand on what we mean by that. So firstly, when we're talking about the nature of co-creation relies on the flexibility to make course corrections. I really want to identify that when we first started this project, we had this idea in mind that the co-creation element would be centered around the survey, but really the co-creation was threaded throughout the entire process. And that starts with the selection of partners that have joined us today and who have been a part of this project as it's been ongoing. And we relied on them as advisors, not only on our full community advisory committee, but to help identify barriers in the focus group recruitment process. Pardon me, I'm stuttering as well. We relied on them to advise us on the focus group recruitment process because, they were able to kind of see early on that it would be a challenge. It would be important to know that the focus groups were all done remotely. So we didn't have that traditional setup of somebody coming in and facilitating a focus group for people who are in-house. We did everything online, and that's going to present a lot of challenges. And so they helped us identify those at the beginning, which helped make that recruitment a little more successful, a lot more successful, I should say. When we're talking about the second point on the slide here, investing the time and energy that is required to build these trusted and collaborative relationships, that also started, towards the beginning of this process when we were scheduling the full community advisory committee meetings that Eileen had referred to earlier, and the other partner meetings that revolved around this project that she also referred to. All of that was done based on what met our partners' needs.
It seems our speaker is frozen, and I think someone's working on that. For those of you who were thinking it was you.
Apologies, everyone. Give us just a couple of minutes and we will get right back into the session.
anybody knows the lyrics to any of the Frozen songs, feel free to sing them at this time.
Hey, apologies, everyone. Of course, Zoom, something with Zoom had to happen. It's our luck today. But while Cece figures out what's going on, the power went out. Why don't we, in an effort to continue to stay on time, would love to continue this conversation. Some of the key lessons that I know Cece was going to go into when we talk about co-creation and working with people with lived experience. This process really requires flexibility, the ability to make course corrections, and investing the time and energy to building trust and collaboration with community partners and people with lived experience. A concrete way that we did this in this project and have done in a number of projects is really to value people's time by providing stipends, compensation for their expertise. And so those are just the tip of the iceberg in terms of the lessons we learned. We will have an issue brief that we will publish after this webinar where you can read more in detail about those lessons. But I would like to now, we can go to the next slide where we begin our conversation with our wonderful community partners. And I will ask Lydia and Amina and Terry to come on video, and we can get started with our conversation. Okay. Thank you and welcome. So could we start with one of our first questions, and really the question around, what are the key messages that you would lift up for our audience today and those who will be listening to this webinar afterwards?
Sure, I'll kick that off. Just reflecting on Cece's remarks, and first of all, thank you for having us. I know all my colleagues here on this panel really also learned a lot from this project. I think one of the things that I wanted to highlight was time. Anytime you are engaging partners, especially with academic institutions and researchers, these are folks most of us don't work with on an everyday basis, right? So it does take time to engage people. And I think key has been having people like Terry and Amina and my provider community. I work with adult day healthcare and adult day programs throughout the state, serving primarily 95, 96, 99% Medi-Cal. So duals is our population of focus. So working with our community partners to identify individuals, and I was tasked, I noticed a question in the chat from Jack, I was tasked with focusing on rural communities and identifying potential participants in those communities. And our services are far and few between in the rural. So I'll talk about that when we get to challenges. Plain language. I think we can all attest to that. And I think Amina and Terry will probably comment a little bit more on language and the importance of not only plain language in English that I'm passionate about, but also plain language as you translate materials. You've got to test it with a lot of native speakers. Meeting people where they are. I mean, we've heard that phrase, we all kind of get it, but I think we mean figuratively and also physically. So having myself, Terry, and Amina be able to identify folks who could feel comfortable in their usual spaces and places for this project was really important. Facilitating input and comments. Again, as I said earlier, people are not used to this kind of work when we're asking for consumers of services or even asking people for their opinions. And so when we're working with so-called experts, I think we have to also find a way that folks who we're probing their experiences with feel safe and feel comfortable. And that also takes some time and trust building with the folks that they're working with. And then the last thing I wanted to say on this, and I think there was a comment on this as well, that face-to-face is always best. The three of us work in environments where it is face-to-face, it is labors of love, it is people, 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 and communication. And yet, for us to do this project, we did have to rely on technology, and guess what? It worked. It worked. And the only silver lining that I can find right now in COVID, or one I can think of relating to this project, is that we were all forced, no matter our age and our experience, to learn Zoom. And that's what enabled the three of us to be able to bring our communities together for this project. It would have been a lot harder had we had, because we're all in different parts of the state. So I'll stop there with those takeaways and turn it over to maybe Terry. Do you want to go next?
Yeah, of course. Yeah, so yeah, I think that I agree that with CC earlier, the remarkable feedback about the community engagement, which is I think that is also crucial. And we continuously innovate our approach through regular check-ins, constantly meetings, and communications via emails with the community organizations and the project teams, and also the importance of meeting people where they are. So I think that this is a key lesson that we have learned. And also, I believe that this project can also support future improvement of any type of survey instruments, considering emphasizing the importance of patient outcomes, the accessibility of healthcare services, transparency in healthcare processes, and in fact, effective communication between the patient and providers, as well as the need for continuous improvements in healthcare delivery. So I do appreciate the opportunity to be part of this project, and also was able to learn all different perspectives from the consumers and other stakeholders.
Thank you. My name is Amina. I'm from the Cambodian Family Community Center. Our agency is located here in California in the county of Orange. We were very fortunate to be a part of this program. It was one of our community members, Mr. Saradeb, was very involved in this program as well. Unfortunately, he wasn't able to attend this meeting today. But I think one of the lessons learned for us is really the importance of community engagement. And I think, Lydia, you said this during our practice run, nothing without us. Nothing about us without us. So having the ability to involve all of our community members with this project really helped enhance the survey tools. When I invited Mr. Serta to this project, he's like, oh, what is this about? What are we doing? And I explained to him what the project was about. I shared with him the survey tools. We went over that. And I think, we mentioned that, sometimes the survey tools are in language, or even though it was in English, it was not in plain language. And that was something that he really wanted to reiterate. That was that, we want to make sure that these survey tools are easily readable in plain language so that our community members can read it through and take their survey, because we know, I mean, for us, we had to translate it into Khmer, which is the official Cambodian language. And it took us that much longer because we were having to translate the language and make sure that even when the language was translated, that it was understandable. During the focus group, we held it in person. So we were fortunate to have done that. And we still had to kind of explain the questions, even though it was translated. So that, again, took some time. So yeah, those are some of the lessons learned, basically playing language in language. And for us, our focus group, we found that it was just easier for us to have it in person, because with our older adults, not only is language a barrier, but also technology was a barrier for them as well. So when we were planning the focus group, we really met them where they were. They were already coming to our agency for services, for groups and whatnot. So we invited them to be a part of this focus group, and they were able to come, and we had about 8 to 10 community members who attended and were able to go through this whole process with us that day. Thank you.
If I could just add one more thing I want to underscore for our audience, is the theme you're hearing is time and trust. So any of you who are thinking about engaging in any kind of a co-creation process, which I think is fantastic, you have to give yourself more time than you think it's going to take.
Yes.
And
yes.
Be patient and be open to feedback all along the way, which I really appreciated about this team. So to me, that's a really big lesson.
And I want to add on to Lydia. I think what you said is time and trust. Here at the Cambodian family, we've been around for 40 years. So community members that do come to our center really trust us with the work. So when we were tasked to create or to organize a focus group, that was something very easy for us to do, because we had a list of our older adult community members who were eligible for dual, and they were able to come to our center and provide us with feedback with the surveys.
And didn't you
it
find
comes
that
with
you
trust.
also, yes, didn't you find you also had to explain what is a focus group? Like,
Absolutely.
right? So
The whole process,
the
the
whole
whole
thing.
process, we had to definitely have to share with them what is a focus group, making sure that they know that this is what we want to hear from you, what is important, what is crucial when we're looking for a caretaker, or what are some of the challenges when you do have a caretaker. So it was it was an eye-opener for me as well, because I was sitting with Mr. Suradev as he facilitated, and I co-facilitated the focus group with him as well. So
And I think that underscores the other thing, Terry, I don't know if you had that experience too, of creating a safe space for them to be able to share, because
yeah.
how many times are they really asked for their opinion, right? They have a lot of
Mhm.
people telling them what to do, when to do it, and how
Yes.
to do it. And especially in healthcare and in social services, and fill out this form and da. So I feel like that's another big takeaway. I'd love to hear, Terry, if you had that kind of experience too with your folks.
Yeah, I think that absolutely. I think that another challenge or obstacles that I have personally experienced is the community recruitment, particularly when engaging with the older adults. The project team has developed a comprehensive one-pager information sheet outlining the project goals and summary. However, in the initial weeks of the advertising, we observed low rates of referrals or sign-ups. However, so after we reflecting with the project team, so we realized that the one pager might have been overwhelming. So considering the potential lower literacy levels of older adults and their challenges in dealing with their chronic illnesses and navigating different social services. So we addressed this by deciding to switch things up. Instead of relying on the comprehensive one pager introduction, we found that the concise flyer with bullet points highlighting the key project goals, location, time, participants, their responsibilities, and also incentives was far more impactful in capturing attention and also fostering involvements. So this experience has also taught us the importance of community outreach and the significance of creating communication products that actually resonate with the diverse audience, ultimately encouraging active engagement and also volunteer participation.
One of the things I want to reflect on, and everything you've said, building trust with older adults with lived experience, and who are receiving home and community services, not just being asked for an opinion without, being appropriately, brought into the conversation. And I'll reflect that, this process and working with all of you, some of the findings that we've learned are really impactful. And I know we'll share this more deeply in the issue brief that comes out, but, we learned like access to services and measures related to access was really the single most important issue for participants. Capturing, post-acute care experiences, especially when it comes to transitions from hospital to home setting, was really important. And, a lot of the other pieces that came out from these conversations was around coordination amongst different providers, empathy, right? Eileen talked about empathy as coming across when working with their care providers. And so, a lot of, these personal information and experiences is shared only after all of the things that you said about building trust with individuals. And so I was reflecting on that as you all were talking about the experience of co-creation. And so my final question to all of you is, I'd love to hear your thoughts about, what we learned, the importance of engaging people with lived experience in this process. And what would you, sort of final takeaways and what you would want our audience to leave today with?
Well, I'll say that for me, I do work with some researchers in my course of my work, and I'm very passionate about transactional research. So bringing the academic findings and research to real people. And I think this was a really great step in doing that. And I hope I see a question about next steps, that this will turn into something usable and people will grab onto these questions and begin to incorporate them into future surveys, as our SCAN Foundation partners discussed earlier, and the California Healthcare Foundation. So to me, that was another big takeaway. And the fact that the dual population, and especially those communities of color, as we call them, are highly invisible in our society. And you have to seek folks out and make sure that they are listened to. I think we've talked about that quite a bit. So to me, that was a really important thing that I learned in this, that we just assume, oh, all researchers are interested in having their research out in the public. Well, maybe not, but my guess is folks on this call are interested in that. So I hope this work that we all were involved in as a passion project does translate now into something quite usable and productive as we all move forward. Amina, Terry, what are your thoughts?
For me, I think for us to learn is to really continue to work with community-based organizations like ours as we continue to conduct research. Our organization has been in the community. We've built trust with the community members. We know who they are. So working with us and trying to reach our community members will be a really great asset for any researchers who are trying to get out there, especially in communities of colors. Oftentimes, we get overlooked, or sometimes community members are not able to speak the language, so they don't think that their voices are heard. So what we try to do at our agency is empower them and educate them and make sure that they know that their voices are heard. And that's why we like to bring them along when we have these types of projects and have them speak up and advocate for themselves as well. Thank you.
Yeah, I think that it's very powerful to involve the primary service users in this co-creation process of the survey projects. So in our context, we have engaged users of home and community-based services. So I think that this approach is particularly impactful because these users can contribute firsthand knowledge and their own experiences. So
Mhm.
making sure that the survey addresses issues that they are truly relevant to them. And this involvement is instrumental in crafting questions that actually resonate with the community's concerns and priorities. So, and also their insights into language barriers also contribute to the cultural sensitivity of the survey. So making it respectful and inclusive. So I personally have learned so much from the community members and staff providing the direct services. So this collaborative process has again proven that designing a survey that is not only comprehensive, but also attuned to the diverse needs and experiences within the community.
Thanks, Terry. Yep. So I know we have about a few minutes left for some questions. There are a few questions in our Q&A box here. A lot of them focused on, the focus groups and how we did them and some of the challenges we experienced. So I can start off, but I will welcome our community partners and Eileen to jump in. We conducted the focus groups. We focused in the Bay Area, Orange County, and Central California. And as we said right in the beginning of this webinar, this was a pilot study, and so our number of folks that we talked to was relatively small. And when you think about the state of California, but I think one of the things that was really important, as you've heard in this process, was really putting the effort and the time into co-creating with the older adults that we were working with and we were talking to. And so we balanced those two together. The other question, well, let me stop there to see if my colleagues have anything else they would like to add. Eileen?
Well, I think CC was more involved than I was in spearheading the process. I saw one question about the moderating, and I know that at least for the Spanish and English, Spanish group and the English interview group, we had a professional moderator. I'm not sure about the Khmer group, how that was moderated, and you can probably speak if you're about to speak.
Yes, Eileen, I can speak to that. So for the Khmer group, myself and Mr. Serdar were facilitating. So we had a training from Sassy. We met with Sassy
Okay.
earlier on and got trained on that. And then we moderated or facilitated the focus group in language. And we had a note taker as well who were able to join us and took notes and sent it over to you.
The community partners did play a role and
Absolutely.
And were compensated for that, for helping us get participants. I think in hindsight, we would have done more to support them earlier on in getting people facilitated. And as I think was mentioned before, we did a mixture of Zoom-based and in-person, and found that the in-person worked better in this case, which is quite different than we found with a lot of other focus groups that I've been doing lately. So I think that's an important lesson and may not hold true across other populations, but I think for this one, that was the case. Were there other questions specific to the focus groups? I wasn't looking at the Q&A.
Well, I see one about were any caregivers involved, and if a person asking the question means familial caregivers, I don't think any of us did, right, Amina or Terry? You didn't have. We did have sometimes a support person, like, Terry acted as a support person, as Amina did. I was not directly, but for my center, I had we identified a staff member who supported our Spanish-speaking participants. So that's another important thing to consider if any of you are thinking about this kind of a process.
Yeah, I was just
they were not directly involved. This was not that would be another type of project, but yeah.
No, that's a great point, Lydia. And I was also going to emphasize that, when you ask people with lived experiences to participate in an advisory committee or be a part of a project, part of the role is also having community organizations whom they trust be a part of that as well. To, you know, we had so many conversations, I know CC did, offline with all of you and with the older adults. And I think that was part of the learning and the co-creation process as well.
And there's a couple of questions. Hi, Catherine, about what are next steps and how will information gathered to be used in the future?
Yes, and I think you alluded to this, Lydia, or somebody did in there. But you know, one of the hopes is that we talk to more people with lived experience to understand, you know, what matters most when it comes to home and community-based services, and that those questions, as you know, everyone will see in the issue brief that's published, those questions that we filter through get used by decision makers, right? And know that these are questions that this is what matters to older adults and people who are using home and community-based services. So more to come on, you know, more to come on that point of next steps. But one of our biggest objectives was to have a set of questions that are you know, validated by older adults, people who are using these services.
And I don't know about Amina or Terry. We're all really busy with our own day-to-day work, but I mean, if anyone listening wanted to talk to me offline just to get a little bit more information on our experience, happy to do that. This is really important work. So, and I don't know if Amina and Terry, you could free up some time to do that too.
Absolutely. If you need some more information from others, just to chat, you can go ahead and email me as well.
The other thing we did with the question set at the suggestion of the community advisory group was to put the questions through a readability scoring tool that you find on Word. And most of them were not at a readability level that's considered accessible for most adults, or for most you know, public announcements or compliance reading material. So we made sure that all of our questions, and that's one way we modified them, is for readability. We wrote them all to a 5th grade level. So something to think about for all the tools that government is either asking or putting out for people to use.
Thank you all. And I know we're at time, and there's probably so much more we can discuss and questions we can answer. If you do have additional questions, please definitely reach out to us. You know, we're happy to then take those questions back to Lydia and Amina and Terry and Eileen as well. But we appreciate you joining today. Stay tuned as our the recording, the slides, and our issue brief will be forthcoming, and we will be sharing it widely within the state of California and partners in California, but also across the country. There is a ton to learn from this process. So thank you, Amina. Thank you, Terry, Lydia, Eileen, for joining and for being part of today's presentation. Take care.
You're welcome.
Bye-bye.
Thank you.